Access Fort Wayne offers reflections of our community. Production facilities provided by Access Fort Wayne are a service of the Allen County Public Library. The views and opinions expressed do not necessarily represent those of Access Fort Wayne, the Allen County Public Library, or any other supporting organizations. For more information about creating your own television program with Access Fort Wayne, call 421-1250.
Hello, and welcome to our show, The American Veteran. I'm Dale Parrish, your host. Carl Fowler is co-host, and our guest today again is Brian Lamm. He spent 20 years in the Air Force, and then he's the DEKALB Veteran Service Officer. I understand you're the president of Indiana Veteran Service Officers also.
This is the third or fourth year that I've had that title. It allows me to coordinate with all of the veteran service officers across the state. The biggest job that I see when I'm dealing in as the president is to provide educational material for our service officers to answer questions. I probably field somewhere in the neighborhood of 20 or 30 calls a day from service officers across the states, as well as emails answering questions. Trying to help them to better serve those veterans within their communities. And even though I've been doing this a lot of years, I still call George Jarbo here, Randy Fairchild down in Lafayette, some of the older guys, because VA is so large and there's so many programs available. One person is no way you could ever learn everything about the VA as an individual. So we have to rely on each other to facilitate finding the most credible benefits for our veterans within our areas. Which I work great.
Do you all meet sometimes?
Yes. We try to have quarterly meetings. I was in one yesterday down in Marion, and VA Northern Indiana Healthcare sponsors that. We had representatives from all the congressional representatives at that meeting, as well as the senior hospital staff, including the director. They inform us of initiatives going on at the VA. We've got some new programs online. We've got some a new CBOC being built up in the South Bend area. We've got some additional annexes that's being built around the Northern Indiana area that's serviced by Fort Wayne and Marion hospitals. They are enhancing a lot of programs over there. The staff is growing. They was telling us yesterday that they're actually going to try to bring in a residency program. They're going to work closely with Parkview and Lutheran to facilitate that, to try to attract some of these better qualified high dollar doctors from Ann Arbor Medical Center, IU Medical Center, where they're going down there and going to school. When they graduate, we want to try to get some back into this community. And so the Department of Veterans Affairs, as well as Parkview and Lutheran, is going to work together, establish a residency program to try to attract some of those individuals back in here. They put in a state-of-the-art dental clinic at the VA hospital. They put in a state-of-the-art optometry clinic at the VA hospital. They just completely renovated the part of the first floor, bringing some more services into there. They've hired some more people. They've got approval to expand those services to our veterans, because the veterans population in this area is growing exponentially, and they're trying to keep up. They work on basically a 10-year outlook, and so they try to develop plans on the veterans populations, the needs of the community 10 years out, and anticipate that so they can go back to Congress through the Department of Veterans Affairs itself and request funding for expansions and capital improvements and those kinds of things. They have to anticipate what the needs are going to be as far as building maintenance and personnel and all of these things. And there's algorithms and there's a lot of data. The guys over there at the VA hospital do a tremendous job trying to calculate out what we're going to need before it gets here. You hear a lot of stories of the VA hospitals are having problems and issues. Yeah, we have our few problems. But I don't think there's any hospital in the country that doesn't have similar issues.
I was going to say, any organization has issues.
Exactly. The vast majority of the guys that come into my office and talk to me about VA healthcare at Fort Wayne, Northern Indiana Healthcare here in Marion, are enthusiastic. They really like the care that they're given there. People that, and I go there personally, I've got other insurance, but I choose to go to the VA because I like the way that they treat me. When I go in there, they actually listen to me. They want to know about Brian. They don't want to know that, okay, I got 8 minutes to get you in and out of my office like many of the civilian contractors do, because they're working off of numbers. At the VA, we're working off of individuals. Most of the individuals that work at the VA, they're either veterans themselves or they got family members that's veteran. So working there is a privilege to them, and they know that they wouldn't have a job if it wasn't for the veterans. So veterans are paramount there. They take the extra time. You know, I was listening to the radio the other day, and there were some people complaining because when you pick up the phone and call the VA, the answer machine says, if you're going to hurt yourself, call this number. Yeah. And they said, they're trying to take my guns. Well, no. And we discussed this yesterday. We have an explosion in suicides within veterans populations across the country.
Exactly.
The decision to put those recordings on there and to have primary care managers and nurses ask you those types of questions at the VA has nothing to do with somebody trying to get your guns. It's we're trying to prevent suicides across the veterans population. And if we can let people know that help is available to them, it's going to benefit everybody. It's maybe going to save the lives of some of our veterans.
Okay, they have a new building here that's to treat PTSD.
Yes.
On State Street.
Exactly.
Yeah.
That's a new facility. We discussed for many, many years. A lot of veterans did not want to go to the VA complex and go to the 5th floor because that was all it was up there, was a mental health ward. And so anybody who happened to be on the elevator when you pushed the 5th floor, they knew what you was going to do. And so that, as well as those facilities on the 5th floor, had not been renovated in many, many years. Our mental health programs at the VA has grown considerably over the years, and they have been provided no more space. So everybody was crammed in there, and they were trying to work around schedules and stuff. And to take care of our veterans in a positive way, they needed bigger, more space, and more private. And so the new facility that we've opened up over there does all of those things. It provides a whole lot more space. It's a new, more comfortable environment. And plus, it gives us some room for expansions of our mental health programs.
Right.
A lot of people don't realize, too, that we've got the Vet Center, which is downtown Fort Wayne. The Vet Center offers mental health counseling, too, to our veterans. Any combat veteran can request mental health counseling through the Vet Center. One of the good things about the Vet Center here is they do outreach. I've got one that comes, Tamara Brown, she comes from Fort Wayne to Auburn on Fridays. I think it's on Thursday, she goes to Kendallville for us, and she goes to Angola, and she does outreach, and she does mental health counseling, both individual and group sessions in our communities. So she is, not just her, but the whole staff, they're packing up their toys and coming to the vets instead of mandating that the vets come to them. I find that those type of programs are especially effective. Those individuals doing the counselings are extremely dedicated to what they're doing. One of the things about the Vet Center is they don't use any drugs. There's no medications issued from the Vet Center. They don't write prescriptions. But their counseling techniques are very, very effective. I've got one group of Vietnam veterans who were pretty much housebound because of PTSD issues and those kinds of issues. This young lady I mentioned before, Tamara Brown, she has those guys having parties now and going out to dinner and having functions. Her ability to transcend some of those shortcomings that they have with the PTSD has been amazing. You know, most of them come into my office to file claims and stuff. And the difference I'm seeing in these individuals is different as day and night. I get spouses calling me and saying, I got my husband back. You know,
starting to open up.
Exactly, they're opening up. They're being able to go out. They're functioning in life again. They've gone back. They've got a job. You know, they're productive members of society again. And you know, that's part of that mentoring program that we can do. When we get in those group sessions, you get to know the guy sitting across the table from you. And so if you have a little bit of problem, you can talk to him a little bit. You know, you've got Tamara Brown and her cohorts that's available to you. That's a lot of things. But when you're falling on hard times, one of the things that I want to touch tonight is the programs that we have available to help you when you run into a tight time. If you go to the VA hospital, we've got a program called HISA, H-I-S-A, and it's ran through the prosthetics department. It's referred by the primary care physicians. But if you have a non-service connected medical disability and you're at the VA hospital and you need to put in a high-rise toilet or put in a walk-in shower, if you have a non-service connected medical condition, the VA can issue a grant to you for up to $2,000 to accomplish those things. If you have a service-connected condition that requires you widen the doors, put in a walk-in shower, handicap ramps, those kinds of things, the VA can authorize, I think it's $6,300 for those home modifications. And these are grants. And they just last month changed the rules. Used to be you had to go out and get 3 quotes, come back, and then the VA would go through them and pick which one of those they wanted to honor, and you could use the money for that. I was told yesterday that they changed the rules. Now the veteran himself can do the work if he's qualified. And he can put that money in his pocket. He just has to show them the receipts and stuff where he's done it and stuff. Or he can go out and get one receipt or one quote and have that work done for him. He can have his son or his daughter or a neighbor or somebody else do the work. The VA wants to inspect it to make sure it's done properly and safely. But they've opened up the door a little bit as far as who can do those and the paperwork to go through.
As long as the job gets done.
Exactly, and it's a way to take care of our veterans. Also in the state of Indiana, we have the Military Family Relief Fund. It's administered by IDVA, Indiana Department of Veterans Affairs. And right now, any post 9/11 veteran who has home repairs, excess bills, their car breaks down, they got excess medical bills, whatever. If you have a legitimate need, they can give you a grant for up to $2,500. You can go in any county service officer across the state and pick up an application. It doesn't take much to fill out. I think it's like 2 or 3 pages long of just general information. Bring in a copy of your bills. We send that down to Matt at the IDVA. Matt reviews it with his staff, and they make a determination. And generally, within 7 days, they're helping you take care of your problems. Yeah. So there's a lot of programs available if you don't know about it. I just got an email yesterday from CANI. They have a new fund available for emergency housing repairs. If you've got a hole in your roof, the floor's falling out, the windows are broke, the door's broke, CANI now has funds from the federal government they're administering specifically to take care of those. I think you've got to be within 80% of the poverty level to qualify for those funds. But most of our seniors and low-income veterans qualify for that program. CANI also has a program to help prevent homelessness with veterans. And they receive funds from the federal government and administer them for the VA that provides a fund so that if you're about to lose your house, you can talk to, I think it's Matt Beers managing that program here in Fort Wayne, but he covers all of Northeast Indiana, that the veterans can go in and get that. Go ahead.
Yeah. I had a question I wanted to ask you last time. When I applied to enter the VA system, it was about 6 months before I could, through George Jarbo.
Are you talking about the VA healthcare, or are you talking about compensation?
Healthcare.
VA healthcare, yeah, I will go through the documentation and look at it. And if I file your claim back for enrollment at the VA hospital, that means that you're good to go. Okay? Effectively, you can go into the VA hospital that day. What I do is I give you a copy of the package, it's DD-214, and we have an emergency room there. Then you just walk into that emergency room, here's my paperwork, I got this problem. And as long as all of the numbers that I have filled out on that documentation is correct and good to go per you, then they will treat you on the spot, no problems, no questions, and it ain't none. Now, we are a little bit behind the power curve down there. I will fax that documentation into the VA healthcare. It will go to eligibility and enrollment. They will actually load you into a system and appoint one of the VA healthcare primary care managers as your doctor. Okay? That takes about 3 weeks for you to get those 3 appointments in the mail. They're going to set you up with 3 appointments. One's to go in there and give them a quart of blood so they can look and make sure all of that stuff good. You're going to have to sit through a little briefing. It's an orientation, 30, 45 minutes on what the VA can and can't do. Then the third one's going to be with your primary care manager. They want to look at you when you're healthy so that they got something to compare it to when you get sick.
Right.
And so from start to finish, you can come into my office in the morning, and an hour later, I'll hand you the paperwork. You can go to the VA, and you can be seen right down there right now.
I'll be darned.
Well,
the information at that time had to go to Indianapolis and approved by somebody.
The way I look at it, you got one belly button to push, and that's mine. Anybody who wants to come in there. The VA started a program called No Wrong Door with the Department of Veterans Affairs here about a year or so ago. Yeah. They really wanted you to be able to go into any VA facility nationwide and not be told, "Oh, that's not my job. You go ahead and go see somebody else." No Wrong Door means that if you come to me, I'm going to find a way to figure out and help you. I may have to fill out the paperwork and send it to somebody else to get you enrolled, or to get a compensation claim filed, or to get a pension filed. But I'm going to do my best as a service officer to take care of you.
A lot of veterans will be glad to hear that.
Yeah. And, I can honestly say that the veteran service officers that we have in place now have the same mentality I do. If you come in my door, we're going to figure out a way to help you somehow, some way. Yeah. One of the other things I did is in August of 2010, I started a nonprofit organization to help take care of our veterans. It's called Quiet Night.
Quiet Night.
Quiet Night is a nonprofit organization. We're a 501c3, and we take no federal money. We take no state money. It's all off of private donations from corporations and individuals in our area. We cover Northeast Indiana. And so if a veteran falls on hard times through no fault of his own, we don't have to follow the federal rules. We can look at what his situation is today and possibly provide assistance to him. We have been able to give away a couple of houses. We have given away numerous vehicles. We pay rent. We've paid mortgages, electric bills, gas bills, fixed cars, clothed kids. We run a food pantry that's open to any veteran in Northeast Indiana. It's the general, if you are out of groceries, you have nothing, we will open that up anytime you want to. It's a dry goods type of pantry that we use, so we don't have to worry about spoilage kind of stuff. And then Quiet Night, one of the officers takes them to the Kroger or the Walmart or one of the grocery stores, buys them the milk and the bread and the eggs and those kinds of things. And like I said, we operate solely off of private donation. That's another thing that comes to mind here. I often get those phone calls in my office. I got this in the mail from this national organization that wants me to send a donation to them. Are they legit? What I generally tell people is, I'm sure a lot of those national organizations are great. However, why would you want to send your money to California or Florida or anything else? Yeah. Find those organizations that operate within your community. It's like Quiet Night. We, by our Constitution and bylaws, we cannot help a vet outside of Northeast Indiana. That's our boundary.
Okay.
And so if somebody donates to Quiet Night, they know 100% that money is going to stay in our community. We have 0 paid employees. So that means 98% of every dollar that is donated goes right into taking care of those kind of things.
I think this is most generous. The population around here seems to be the most generous that I've ever heard of.
Yeah, it's fantastic. We really have a pro-vet mentality in Northeast Indiana. If we can help the veterans in any way, that's exactly what we're going to do. It's just finding those targeted groups of individuals that need help and going out and helping, because you're vets yourself. There's a lot of pride in your back pocket that preclude you from going out and asking for help a lot of times, you know. And so that falls in right with going back to Quiet Night again. That's why we call ourselves Quiet Night. We're quiet. Mm-hmm. Under no circumstances do we ever release the names of the individuals that we're helping. We don't tell nobody. They're not published. They're locked up. Because if you're running on hard times, the worst thing in the world we can do is tell all your friends and neighbors that you're on hard times. That's not doing you a bit of good.
Yeah.
Right.
And so if you need help with the utility bills, you can contact Quiet Night. We help you with the bills. Nobody ever knows about it. It stays
Anybody
under
wants
cover.
to contact Quiet Night to contact you.
Yep, and you got quietnight.org is the, it's K-N-I-G-H-T, Quiet Night is a website. Phone number is 260-570-2236. And if you got one that's in need, if somebody needs groceries, we open that food pantry up. We take care of our vets, you know, right away.
Yeah.
So it's a good deal, and it's local. Any of the other grant programs, whether it's through the Department of Veterans Affairs, whether it's through KNI, or whether it's through the Indiana Family Relief Fund, any county service officer across the state has access, direct access to those programs as well. And we can get that information out to them and get them taken care of.
Yeah.
Yeah.
You know what? You was an Air Force veteran, and we never touched at all on that.
Yep, I got into the Air Force back in 1978 in lovely Virginia. Yep, went to Champaign, Illinois for school, Minuteman II Electronics, and decided I did not want to do that. Got out of that program and went into flight operations. Got sent to the 55th Wing and RC-135s. Flew around on those for a bunch of years there. Worked at SRC for a little bit, the SAC Recon Center and SAC headquarters. Transferred from there to RAF Mildenhall. Worked at RAF Mildenhall for 4.5 years. RC-135s again. We also had some touches into the SR-71 and U-2 programs there. Left there, went to Athens, Greece, spent Hellinikon about a year there. Left there, went to Eglin Air Force Base with F-15s. Stayed at Eglin 6 years. Then I transferred to main base and working in test programs. And then lo and behold, Lockheed wanted me to come out to Ontario, California and be a liaison officer out there, so we did that. We stayed at Ontario for about 3 years, then transferred to Palmdale for my final 4 years in the Air Force, working out of the Skunk Works. Worked on Special Mission 130s, the SR-71 program, the U-2 Dragon Lady programs, some other programs at Lockheed there, some really neat stuff. Huh?
Spy planes.
Shh, shh. There's no such animal.
Oh, okay. I didn't know that.
I had a very great career. I can't say enough about the Air Force and what it did for me. If we've got anybody out there who is thinking about the military, you know, the Air Force is a way of life. The camaraderie in all branches of service, I don't care which one you go to, it turns you from a boy to a man. Mm-hmm. It allows you to manage programs worth millions and millions of dollars. You know, it's allowed me to fly airplanes. It's allowed me to do everything except jump out of them. You know, that was one thing that I refused to do, is I didn't jump out of any airplanes while I was in the Air Force.
Yeah.
Wasn't forced to.
Exactly.
You're lucky then.
So you became a pilot then?
Yes, I got my pilot's license. That was in 1982. Yeah.
Okay.
But we had some issues, and so I had to give up my flying career because of some lung issues. I got exposed to some muriatic acid that ate my lungs, and the flight surgeon said I couldn't fly anymore, so I had to get off flying status. Yeah.
That's hard to do, isn't it?
Oh,
Give
yes,
it
it is. Yes, it is. Needless to say. But, you know, looking back on it, I wouldn't have done anything different. And when I talk to most of my veterans coming through the office, they tell me exactly the same thing. You know, some of them stayed 20, 25, 30 years. Others stayed, you know, 3 or 2 years. And regardless of who you talk to that's been a veteran, they really cherish their time in service, regardless of what's the ranks.
Yes.
You know, the only guys that I have to scratch my head about is the Navy guys. I can't understand why in the world you would want to go spend 6 months on the pond with 1,000 other guys. It just makes no sense to me.
Well, it's that sense of duty, I suppose.
I guess, it's dedication.
The opportunity to give back to your country, to serve, like you say, whether it's 2 years or whether it's 20 or 30, generally builds some character in an individual.
Absolutely.
And I think most vets are well behaved.
Yes, for the most part.
People when they come back.
Exactly. We're running into situations, and when I'm talking to people in corporations around my area, Northeast Indiana block here, that manage HR departments or presidents or CEOs or plant managers, I try to encourage them to hire these vets coming back from the military, because we've got these young kids and they have been educated, they have been trained to operate high dollars worth of equipment. Their discipline is impeccable, rather, and these are ideal candidates for most companies. When you hire somebody, you want them to do one of two things: either make me money or save me money. Well, that's exactly what our GIs coming out of the military have been trained to do. Fraud, waste, and abuse, they're always looking ways to save money.
Right.
Making money, they're always out here looking how to do the job better. So if you've got a job opening in the community, look at some of these young vets coming out of service. They're used to working 12 or 14 or 16 hours, because in the military, you work until the job's done.
Yeah.
So you've got a good, strong work ethic of these individuals. They don't mind putting in the time and the effort to make sure that it's done right. Yep.
And most of them live according to that creed of, show me a better way.
Exactly. Exactly.
Show me a better way, and I'll do it.
Exactly.
Yeah. We've got a couple minutes here yet.
A couple of minutes left?
Yeah.
Well, let me back up here and talk about one of the programs that is sort of near and dear to my heart, and that's the Aid in Attendance program.
Okay.
Aid in Attendance program is a program set up by the Department of Veterans Affairs to take care of our seniors who fall on hard times. It's a simple program. It's effective. It's administered by the PMC, the Pension Management Center out of Milwaukee, Wisconsin. The process normally takes 90 to 120 days to go through the system. Some of the things that you're going to need to bring into the office when you bring is you're going to have to get a 2680 form, which you can pick up at any of the service officers. And that's a letter to go, 2-page document to go to the doctor, your doctor, that says you need some assistance. As soon as that doctor completes that document, then we sit down and we figure your assets and income. The program says you've got to have less than $80,000 as a general rule. It is fudged one way or another based on your age, but as a general rule, 80,000 is a cutoff. And then we take your gross income, subtract out any medical expenses, and then we come up with a delta. In a lot of cases, some of these senior citizens that we have, their income's so low that just by paying the $104.90 a month Medicare automatically qualifies them for the program because their income's so low. Does that mean that they're going to get $2,000 a month necessarily? No. If they're only paying for Medicare, they may only get, $200, $300, $400, $600 a month because it's a means-based program. Mm-hmm. But it's something. And when we look at individuals in our community who are surviving on very, very small pensions and Social Security checks, it may be the difference between going to the grocery store and picking up some groceries for this week or paying the electric bill. And that's something we don't want anybody to face.
Have to make a choice.
Hate to shut you off again. Brian, thank you for your
sir.
service.
Thank you.
Thank you, Brian.
It's always
Appreciate
a pleasure.
Okay.
I hope you enjoyed the show. Before I leave, I'd like to thank my co-host. This is his 4th anniversary of being on the show. Thank you, Carl.
I didn't know that. It's all been fun all this time.
Thank you for watching. Hope you enjoyed the show, and thank you and good night.